Hello, Daddy. How are you?
Hello, Shinza. How are you? Tell me.
I'm good. Dad, there is one question
How was your
from
yesterday?
yesterday was very terrifying, but now Alhamdulillah everything is good.
All is good now.
Yeah.
So yesterday was like something like unsuspectable that Qatar failed. But
Yeah.
anyhow, everything is calm, cool here, and we are the government of Qatar's play what a peaceful and beautiful reaction. So we love Qatar government and guys pray for the peace in the world, especially in the Middle East, and we love you all. Yes, tell me, what is Shinzaz your plan for
And
today?
Daddy, for today there is one question, as I mentioned earlier, that the question is from ManukJhajha, your
Yeah,
follower.
Manok is my regular follower and he loved to ask me the question. And because of the Manok, I need to keep ready myself to answer. And because of Manok, I becoming a young perfusionist again. I was
So he's
learning.
asking about the uses of corticosteroids during the
Yeah,
bypass.
corticosteroid usages during cardiopulmonary bypass and their contraindication. This is the question by Manok. So we'll talk about the corticosteroids. Usually, the corticosteroid is used in mostly in a pediatric surgery, pediatric cardiopulmonary bypass surgery. Yeah, not adult, very rare. But let's start about the usages of the corticosteroid during bypass. So as we know that the cardiopulmonary bypass primarily modulate the systemic inflammatory response that can occur due to the contact of artificial the blood into the artificial tube or in extracardiac circuit, which create like ischemia or reperfusion injury and of course endotoxemia. And then now we're going to categorize here the primary indications. What are the primary indications? The full number one is like we have a systemic inflammatory response syndrome, and this response is due to this. The response is strong response is due to cardiopulmonary bypass, and the corticosteroid reduce the cytokinase release. So if especially in a pediatric surgery we use during the bypass as a perfusionist we can give the corticosteroids, some amount of the corticosteroid which we're going to be discussed later further now. And this is one of the indication. Number two, reduction of the post-operative pulmonary dysfunction. This is not our today's topic. And of course there is a neuroprotection. So in a especially in a cardiac surgery when we are using the corticosteroids, so in this we get a neuroprotection, especially neonates, and to reduce the cerebral edemas and for cerebral protection, and especially for the potential neurological injury to preserve, to save and be away from the neurological injury. So we use the corticosteroids. And number fourth, we have the preventional adrenal insufficiency. This is even especially in the patient on the chronic steroids or with the relative adrenal insufficient stress. So let's talk about the medicines used during cardiopulmonary bypass, especially used by the perfusionists. So if we talk about the corticosteroids, it manage, as we mentioned, it manage the inflammation, prevention of the adrenal insufficiency, provide organ protection, especially in the selected cases, and the drugs we are using for as a corticosteroids is like usually in a pediatric surgery we are using dexamethasone. So dexamethasone is basically used for the anti-inflammatory neuroprotections. The dose of this dexamethasone is like 0.1 to 1 milligram per kg through the IV, as by the anesthesia they started, and oftenly like 8 to 6 milligrams, like a single dose. Usually we give on a pump, and then we have and some of the center they are using the hydrocortisone. Hydrocortisone is used to release the stress and steroid annually insufficiency coverage, and doses is like 100 to 200 milligram IV bolus, and then in infusion they start like a 6 hourly or 8 hourly. So on a pump we give a bolus like 100 to 200 milligram. These are the medications usually used, and mostly we are using the steroids in pediatric surgery, not in adults. Adult very rare we are using. So the clinical uses of the corticosteroids in a cardiac surgery usually is blunting the systemic inflammatory response to cardiopulmonary bypass, especially I already mentioned, especially in a pediatric cardiac surgery, and often given as a single dose to pre-CPB. Even they give anesthesia, anesthetists give the dose in before to go on the bypass even. And secondly, we have the neuroprotections. So usually, particularly it is in unitaries and infant undergoing the deep hypothermic circulatory arrest. The time of we do the TCA, total circulatory arrest, especially in a pediatric surgery, and in adults also. So this drug will going to help. Pulmonary protections, let the patient usually go for the long bypass, especially in the pediatric surgery, and it reduce the post cardiopulmonary bypass, pulmonary capillary leakage and edemas. Prevention of the post-operative nausea and the vomiting. So now dosages, indications, doses, the benefits of the corticosteroids. Now we're going to talk about the contraindication and the risk of usage of the steroids. So number one, I categorize this in like 4 or 5 points. The first point is active infection or sepsis. The steroids suppress the immune response and can worsen infection or delay healing if used sometime. Number two, poorly controlled diabetic mellitus patients. Steroid can cause significant hyperglycemia, increasing the risk of the post-operative complication. Number three, gastrointestinal ulcer or recent GI bleeding. So corticosteroids can exacerbate or precipitate the GI bleeding. Number four, severe hypertension and heart failures due to the fluid retention and an increase in the vascular resistance. There is a chance of a severe hypertension and heart failures. Number five, you have the not least the wound healing impairment, so increase of the risk of the delayed healing and the wound infections. So usually these are the contraindication of corticosteroids. Mostly as a perfusionist. In a pediatric surgery, we are using the corticosteroids. In a pediatric surgery, we are using the steroids, especially like dexamethasone. When we start the bypass, so usually the anesthetists prepare the drug and they will give it to you you can add it on your heart lab machine. So for the last is the most important thing. Before I'll just wind up the things, keep in your mind all medications, whatever you're using during the cardiopulmonary bypass, and especially on the heart lab machines. All the medication was supervised and ordered by the anesthetist. So always communicate with your cardiac anesthetist and communicate with them by you before adding in your extracardiac circuit, adding in a pump. And each medication have their side effects. So my personal advice to all of you, to whenever you give any medications, give slowly and see the reaction of the medication. And secondly, for the steroids, like corticosteroids, especially in a pediatric perfusionist, always communicate, always discuss with your cardiac anesthetist and your surgeon, and make your communication very clear, so people know that you are going to add this medication. So always check the vial of the medication, expiry date of the medication, concentration of the medications, amount of the medications, label the syringe, label the vial, sign your and time mention on the syringe, so prior to added, and someone if prepares, so don't use the medication which is prepared by someone else. So always be be the witness prior to use any medication on cardiopulmonary bypass. So I try to answer the question of the Manuk that related to the usages of the corticosteroid and the contraindication of corticosteroids. My dear brothers and sisters and my dear students and my followers, my subscribers, if you like this type of video content, please share this video and content among your Christian community and among your allied health community. You can give your comments, even negative and positive comment. Every comment is valuable for us to make us more good videos for you, and we can enhance our knowledge with your questioning. So we'll come up with a new talk, with new discussion next time again. Have a nice and good day. Bye.